So we'll conclude our read aloud of pandemics today. I'm going to skip past cholera pandemics and get us to some information about the stages of a pandemic before we move on and learn a little bit about one more famous pandemic in history. After a pandemic ends, there's usually a quiet period before another one begins. So the last time we had a pandemic in the United States, it was the swine flu pandemic, I believe. And that was not quite 10 years ago. So it has been a quiet period before this one. During this time, governments and other organizations may monitor infection rates and plan strategies to minimize the effects of a future pandemic. Our government did that for a while, and then the current president actually stopped our pandemic response team a few years ago, so we were caught a little unprepared because of that. According to the World Health Organization, pandemics emerge through several stages. Here's the first stage. Is called the interpandemic period. During the time between pandemics, the risk of a pandemic outbreak is low. Medical organizations monitor reports of infections around the world. Some infections can pass from animals to people. Infection data, therefore, are collected for both wild and farm animals. Physicians and scientists also watch for any unusual infection that might signal the development of a new type of disease. So basically, in between pandemics, there are people who are checking to make sure that illnesses are not getting out of hand, especially illnesses that might cross over from animals. Stage 2, pandemic alert. A pandemic alert is issued when early warning signs indicate that a pandemic may be about to emerge. Warning signs include identification of a new disease or a new type of an existing disease, changes in the pattern of the spread of a disease, and increased infection rates. As the alert period progresses, the infection may spread rapidly in a location, causing an epidemic. Governments may restrict travel and order vaccination programs to prevent an epidemic from developing into a full-scale pandemic. Emergency services may carry out special training to prepare for a pandemic. And then the last stage is the pandemic period itself. The infection may spread despite all efforts to limit the disease during the second stage, developing into a pandemic. So this first stage took place in China, in the Wuhan area. The government did try to restrict travel. We didn't have a vaccination program and still don't. But there were attempts to slow the spread of this disease in China itself that didn't end up working. This illness that we're dealing with right now just has too long of a period where you can't tell you're sick before you get sick to make it easy to control. It's really easy to spread this without knowing it. So we ended up with the pandemic itself. Pandemic! Nearly everyone in the world is affected in some way when a pandemic develops. People can be affected directly by catching the infection or indirectly by the social and economic consequences of the pandemic. Restrictions. We know about some of these. If a pandemic were to begin, the movement of people would likely be restricted to minimize the spread of infection. The restrictions may include travel to and from countries hit by the pandemic. So there are lots of places that will not let you travel there from the United States, and there are some places that you can't travel from there to the United States still because of the pandemic. The restrictions, people traveling from infected areas would have to spend time in quarantine where they would be isolated from other people until it was clear they do not have the disease. Some health experts have recommended that in extreme circumstances, people be forcibly quarantined to protect the rest of the population. Other restrictions might include closing such public spaces as theaters or libraries within the affected area, reducing transportation services, and limiting non-essential travel. So in the United States, we did all of that in the spring. We asked people not to travel from state to state. We closed a lot of different public places, including theaters and restaurants. And it looks like we might need to do some of those things again to keep ourselves safe this winter. Health services. Most hospitals are busy places even in normal times. In the event of a pandemic, many doctors and nurses would be reassigned from their regular duties to help with large numbers of infected people. Medical staff, including orderlies and assistants, would also be taken from their usual duties to help treat victims of the pandemic. So my wife, Dr. Grady, was assigned to a team this summer where if things got bad enough, she would have had to stop doing her regular work and help out at the hospital. Now, that hasn't happened again this fall, but our local hospital system is starting to ask people to please come and help at the hospital itself if they have a medical background. So we might get to a point where we need to ask people to stop doing their regular jobs in healthcare and start helping at the hospital. Communication, work, and education. During a pandemic, governments would make public announcements explaining what people should do to protect themselves and describing any new restrictions or regulations. So, for example, our local government, the health office, has recently announced some more restrictions and some more recommendations that public gatherings be limited and that people wear masks. To slow the spread of the disease, school and daycare centers might close. Offices, stores, and factories would also close as people were advised to avoid public places. Many services, including banking and postal services, would be disrupted. All that's happened. Those things have all shut down and then reopened again, and they might need to shut down or be disrupted again. Supplies. Transportation restrictions and illnesses among workers during a pandemic would likely disrupt the deliveries of goods and fuels in many areas. Energy supplies, such as gasoline, would likely be limited. In a severe pandemic, rationing of essential items may be necessary. We haven't gotten here yet. Rationing would mean you're not allowed to buy as much of, say, gas or food as you like, although we have seen some rationing of toilet paper. You might remember that from the spring. Let's talk about the influenza pandemic of 1918 before we wrap up our read aloud of this book, Pandemics. For many people, an outbreak of influenza or flu is just a normal part of winter, but the influenza outbreak of 1918 to 1919 was one of the worst pandemics humanity has ever suffered. Experts estimate that worldwide about 25 million people died during the 18 months of this pandemic. What caused the pandemic? Influenza is caused by a virus. There are three main types of the influenza virus known as type A, type B, and type C. Each has many variations or subtypes. In people, most influenza is caused by type A or type B viruses. An influenza virus is often named for the place where it initially strikes or happens first. In the 1918 to 1919 pandemic, the virus became known as the Spanish flu because the Spanish government, unlike the governments of other countries, made no secret of how severely the disease had affected Spain. Many researchers believe the pandemic may have actually begun in the United States. So this pandemic was called the Spanish flu because in Spain, the newspapers were actually allowed to say how bad it was, and newspapers were not allowed to say that in other countries. So people thought, oh, it's really bad in Spain, it must be Spanish. But it was actually not from Spain, it was just talked about a lot there in public. In 2005, researchers determined the complete genome of the 1918 virus. Some scientists think the genome indicates that the virus came from a type of influenza virus that normally only affects birds. So just like the current coronavirus probably came over from an animal like a bat, this influenza probably came over to the human population from a bird. Early in the morning of March 11th, 1918, a soldier went to the camp hospital at Fort Riley, Kansas. He did not seem to be seriously ill, but he had a headache, fever, and sore throat. He was quickly joined by another soldier and then another, until by lunchtime there were more than 100 cases in the hospital. The soldiers carried the virus with them when they traveled to Europe to fight World War I. But at this stage, the infection did not seem particularly serious. In July 1918, influenza took hold in Poland. By August, people noticed that the infection was becoming more deadly. It seemed that pneumonia often developed after a person became infected, and many patients died within 48 hours of the appearance of influenza symptoms. Wow, that's really fast. The coronavirus takes weeks to kill you if it's going to kill you at all, so this must have been really scary. 48 hours is just 2 days. You get sick, and then you're dead in 2 days. This infection also spread very rapidly from person to person. By the autumn of 1918, the influenza pandemic had spread around the world following the patterns of trade routes and shipping lines. So down here we have a nice little chart. Well, it's not that nice, with estimated numbers of deaths. You can see there were some places that were affected a lot worse than others. Australia only had 14,000 dead, but India got hit with 18 million deaths. Wow, that is a lot. That is a very serious situation in India. Treating the sick. With so many people suffering and dying from influenza, governments were forced to take drastic action. There were not enough hospitals or medical staff to treat the huge numbers of people who were ill. Volunteers helped with nursing care, and many medical students were given duties. In the United States and other countries, temporary hospitals were set up in such places as school halls, gymnasiums, and community centers, controlling the spread. Governments around the world did many things to combat the spread of the disease. One effective method was the use of quarantine to reduce contact between people. Many theaters, churches, schools, factories, and stores were ordered to close. Posters advised people on the precautions they should take to avoid catching or spreading influenza. In the United States, people were given face masks to wear in public to prevent the spread of the virus. One slogan of the day urged people to obey the laws and wear the gauze. Protect your jaws from septic paws. Some bus and train companies refused to carry passengers who were not wearing masks. In Japan, travel in and out of the country was severely limited. Anti-influenza remedies? People were so frightened by the flu that they were ready to try almost anything to avoid it. Some companies sold products they said were effective at preventing infection. Others sold such products as herbal drinks that they claimed would strengthen the immune system and help people fight off the flu. Such products were ineffective. So you can imagine, it's kind of like today when we still don't really have good treatments for the illness that we're dealing with. Not only do we not have a vaccine, but we also don't have a way to treat coronavirus effectively. We are developing some medicines, but that takes time too. And so just like that, 100 years ago in 1918, they didn't have very effective treatments for people who had the flu. There were no good medicines to help you if you were sick. Burying the dead. The death rate from the 1918-1919 flu pandemic was extraordinarily high because the virus involved was much deadlier than those responsible for other flu pandemics. In the first months of the pandemic, 25 million people died, compared with 25 million deaths from AIDS in the first 5 years of that epidemic. One man described his childhood memories of the flu pandemic in the United States. The first time that I was aware that something was amiss in our normal living was when my father told me, "Son, most of the employees are sick. We don't have anyone left to run the store. Everyone is homesick or in the hospital sick." And within a week or 10 days, my father told me that this sales lady had passed away and another one had passed away. So as I recall, out of the 8 or 10 employees, 4 of them passed away, and the passing away came about so quickly. So there's more in this text about different pandemics, including the HIV/AIDS pandemic, which was a serious pandemic that has lasted since the 1980s and is still ongoing, although it started to be calmed down. There's some ideas about preventing a pandemic, which we might want to look into for next time in terms of our country. And there's the most recent pandemic, like the one we're dealing with now, which is called SARS. Coronavirus is a relative of SARS. And this was a pandemic that was controlled before it got too far, unlike the one we're dealing with today, which is covering over the whole world. So that's what we're going to read, though, for today together. If you're interested in this topic and want more information about how people have dealt with pandemics and how we can deal with it in the future, I would encourage you to check the link in the description and to read about it for yourself. I will see you in class or at another time. Bye for now.